In this section of the module, we continue our exploration of how different countries have applied ICTs in different sectors. Again, I repeat that the examples given here are not exhaustive. They are only indicative of the possibilities that one has of using ICTs. There must be many more examples and case studies within your own countries and your jurisdictions, and I invite you to continuously reflect on those, find them, and learn from them as you see examples of what others have done. Earlier we talked about Millennium Development Goals 1, 2, and 3, and we ended the previous section by talking about the issue of gender and ICTs. Goals 4 and 5 and 6 of the Millennium Development Goals all impact upon different aspects of health, which is why I have chosen to club them together in the overall title of ICTs and Health. Again, we look at both direct and indirect interventions and in the way in which technology can be used. Goal 4 of the Millennium Development Goals specifically charges the world community to reduce child mortality and to reduce by 2/3 between 1990 and 2015 the under 5 mortality rate. That means children were dying below the age of 5. Similarly, Goal 5, improve maternal health. But that is, the target specifically says reduce by 3/4 between 1990 and 2015 the maternal mortality ratio. And this is very, very important because the health of a woman and the child is critical to the process of equitable or equal development. Again, given the ongoing epidemics and the pandemics of HIV/AIDS, malaria, and other diseases such as tuberculosis, Target 7 argues that we must halt at least by 2015 and begin to reverse the spread of HIV/AIDS as we also address other diseases such as tuberculosis. These are important targets and important goals that the global community is to achieve, because they are also affected by such things as education, they are affected by such things as environment, and they are also affected by poverty. One will begin to see that the linkages, especially between health goals and environment sustainability, a little later. But while we continue talking, let us explore in the different ways in which ICTs and health are interconnected. Who are the stakeholders and who are the beneficiaries of health services? On the one hand, it is anybody like you and me, ordinary people, rich and poor, vulnerable, women, children, boys and girls, who are the beneficiaries of effective health, timely diagnosis, timely treatment, and timely access to specialist consultations. But in order to provide these services to us, to you and to me, there are also healthcare providers. These are the health policymakers, the medical professionals, such as doctors and nurses, the caregivers also at the primary health level, for example, the midwives in villages, often providing the medical support on a first aid basis. So on the one hand, we have you and me as beneficiaries, and on the other hand, we have healthcare providers. Both groups of stakeholders can be benefited by using ICTs. Essentially, when we look at how you and I can be benefited, the most common application of ICTs in health is that of telemedicine, the linking of patients in a remote area to doctors in the city through technology so that diagnosis and treatment can be done. There are many examples of this all over the world, and you begin to look at them, whether they're in some ways in Afghanistan more recently, in Pakistan, in Mongolia, in Malaysia. I draw your attention to different case studies of both direct and indirect interventions in the area of application of ICTs for health. One such site is Medical Online Malaysia, where both individuals and doctors can turn for advice. In a sense, this combines telemedicine with an indirect application of linking doctors to continuing medical knowledge. And this is an important site, but there must be many others, both in your own country and elsewhere, that you should really explore. Continuing medical education and the linking of doctors to doctors and the linking of medical practitioners and health professionals to knowledge in different parts of the world is critical to the success of any healthcare provider. This means that doctors, through a network, should be able to get access to latest developments in medical research and in treatment of different illnesses. TINES 2, which is the Trans-Eurasia Information Network, is one such that is being created in order to provide the linkage between medical practitioners of different countries in Asia. It is worth exploring because it actually covers the regions that are in Central Asia and which are finding that particularly on health goals are gradually showing signs not of progress but of regression. Mongolia Health Services is one example of telemedicine, and I would recommend that you look at this particular website to see whether some sort of health service can then be provided through ICTs within your own countries and your jurisdictions. I draw your attention to something that is very new, and therefore I had updated it for this presentation, and that is the Arogyashri health insurance for the poor. This particular scheme is important because it addresses an issue which has been troubling both rich and poor countries: the provision of a health safety net for those without access to good health care. As you know, this is a topic that is being hotly debated all over the world, but one example of an attempt done again in the state of Andhra Pradesh in India is worth looking at because of the way in which they have used ICTs to make the linkage between healthcare providers, patients, the government, and corporate hospitals and the private sector. In this public-private sector initiative, in Arogyashri health insurance, the government is a major stakeholder. The government pays an insurance premium to a health insurance company to cover the cost of tertiary health treatment for the poor. In turn, corporate hospitals, which are empaneled with the government, can provide treatment free to the poor and in turn be reimbursed for a proportion of the expenses through the health insurance company. The success of this scheme in Andhra Pradesh is really based upon the ICT backbone that has enabled both the provision of medical insurance, the payment of bills, the reimbursement that hospitals get from the government, and the verification not just of the diagnosis but of all the tests by doctors located in different parts, and all through an ICT backbone. The Arogyashri award-winning experience shows that it is possible in a public-private partnership to improve the quality of healthcare that people can get no matter where they are in the state, particularly when medical bills can sometimes constitute 30% of a poor person's monthly income. And this is very, very important because when the income burden is, expenditure burden is reduced, the expenses can be then allocated somewhere else. As we link health researchers, the word WHO has come up with HINARI, which is a support system, the Health Inter-Network Access to Research Initiative. Many doctors in developing countries find access to medical journals and latest research literature very difficult. The HINARI makes it possible for a doctor anywhere to access literature. So in health, we have looked at a direct intervention of telemedicine, such as Medical Online Malaysia. We have looked at support systems like the Arogyashri. We have looked at research networks, which are critical for the advancement of healthcare, such as TIANS and HINARI. We turn now to the issue of the Millennium Development Goal 7. And this goal is important because it links with the other goals of education, gender, and health, ICTs, and the management of natural resources. Goal 7 essentially talks about environment sustainability, where Target 9 argues that it is necessary to integrate the principles of sustainable development into country policies. Target 10 talks about reducing the number of people without sustainable access to safe drinking water, and Target 11 to reduce and improve the lives of people living in urban slums. All of these are important because when you look at the environment and you look at improving, for example, air quality, it automatically has an impact upon reducing the incidence of tuberculosis, as is prevalent in many countries, particularly Central Asia, such as Afghanistan. So there is a link between these, and the link is established because when we have to look at natural resources, when we have to look at environment, we also are looking at other parameters and other goals. What can we use ICTs for? We can use ICTs for looking after an environment, environmental surveillance and reconstruction. We can look at ICTs as providing disaster warning, prevention, relief, and rehabilitation, and for mapping climate change. Out in the Pacific Islands, susceptible to climate change, susceptible to tsunamis, susceptible to floods and cyclones, it is very, very important that there be timely warning systems enabling people to move to safer locations. The Tikiwiki Nuaru is one such example of using ICT in the island of Nuaru in order to provide such timely or early warning systems for the villagers. And early warning is the first step in the prevention of natural disasters. We cannot prevent earthquakes and tsunamis, but certainly we can prevent the consequences of them by being forewarned, if possible, even a few hours ahead. The TWOS network, which is the links Europe to Southeast Asia in order to look at tsunami as a disaster, is another opportunity and another way of using ICTs. The important thing to remember here is that ICTs enable the linkages between both databases, networks, seismological station, deep sea technologies, and systems in different parts of the world. So when they are networked, they can also have early warning systems, preventive measures, disaster relief and mitigation, and rehabilitation. These are some of the instances of using technologies to link different organizations, not so much directly, but indirectly in a more supportive way. I will take you only briefly through the MDG 8, which basically talks about developing a global partnership for development. Developing this global partnership for development means basically in Target 12 that we must have an open system in a globalized economy. We must address special needs of the least developed countries, which is what we're doing through these modules. We must use the special needs of landlocked countries again, and various other targets. And one of the targets, Target 18, specifically mandates countries to use information and communication technologies to address the needs of development. So Goal 8 is really building a partnership between individuals, between countries, between multilateral countries, and between multilateral agencies and countries themselves. And it is very important because unless we come together to build these partnerships, we will not be able to take a joint approach to development problems. But as we begin to look at how we use ICTs, there are other dimensions which are very important and we have to look at. And when I say that we have to look at these, one of the reasons for the inability of countries to reach goals and targets and to improve development has been the issue of governance. Governance is an outcome which is basically visible in how a system or a country is run. Whereas the formal apparatus, the formal system of administering a country is called government. And e-government is the application of information and communication technologies to providing the services to citizens and to managing and administering a country effectively. E-governance, very often confused with e-government, is much broader concept which encompasses a wide range of relationships between government and the citizenry, civic engagement, voting patterns, the way in which citizens communicate to government, the way in which government becomes more transparent. All these are part of a larger governance mandate. But e-government specifically is the use of technology to provide services to citizens. And it is important that we understand this distinction. A small project, one way in which government delivers its services, can be seen in the Mongolian Taxation Authority, where it is possible for a Mongolian citizen to file their taxes online. This is actually one aspect of government functioning. So when we say this is government to citizen or G to C, and there are many others in many other countries where such opportunities exist, but these are small and they are not part of a larger integration of all government services in one single way. These are individual experiences done by individual ministries and individual departments tasked with individual functions in an effort in which they try to bring about much better and more transparent reform of a system. I draw your attention to a way in which a government tries to engage with its citizens in a more transparent manner, for example, as governance. The Right to Information Act, India, which is one of the pioneering acts in developing countries, 2005, actually charged the government with being open and transparent and responding to citizen complaints. Today, through the Right to Information Act website, an individual can file a complaint seeking information. An individual can appeal against a government decision, and it would be heard in terms of providing information. Disclosure to information is one of the most important parts of governance. And I can tell you that this is a very, very powerful way of using technology, because at the click of a mouse you can file a complaint and the concerned officials are legally bound and liable legally to address the requirements. I would like to add here that the way in which the earlier NREGA project is run and the way in which some of the other ICT projects are run in India are based upon the ability of citizens to use the Right to Information Act to access information. So as we talk about indirect interventions enabling poverty reduction, enabling education, right to information and the use of ICTs there is an enabling environment, is the laws and regulations that allow such programs using ICTs to take place. And that is what makes this particular portal a very interesting one to look at in terms of governance. One may argue that there is no connection between ICTs and peace. But one may also argue that this is a new and upcoming field and that there can be no development without peace. Peace and stability are critical to development. Can ICTs play a role in terms of promoting peace? Peace is not merely about just promoting stability. It is also providing information and support in post-conflict societies. and of providing information to NGOs and other organizations who need the information to coordinate their own efforts. So ICTs and Peace is a newly developing area of exploration. It is still evolving, and it is hard to see at this stage which is the direction in which it will evolve. But it is important to recognize that building peace through building networks through ICTs is important, and it is important for all of us who want to see development take place in an atmosphere of peace. There are some sites where one can explore. Relief Web, which is a site of the United Nations and which enables us to track what are the relief and rehabilitation projects taking place in different parts of the world, where there are emergencies, where there are appeals for funding, where we as individuals can contribute to a better and a safer world, and a world in which there is less inequity. Similarly, AlertNet is a service of Reuters, the news network, which again tries to alert humanitarians to crises taking place in different. The importance of these supportive websites is that they provide timely information for relief agencies, for UN organizations, and for other multilateral agencies engaged in providing care to those who are vulnerable and affected by crises. To sum up this session of our discussion, essentially we were talking about how many of these examples are organized in terms of sectors. We looked at them not in terms of a broad, diffused set of cases, but tried to link them very specifically to the Millennium Development Goals. However, it is important to remember that an integrated approach is critical. You cannot look at them in real life in terms of isolated examples. They are linked, and one must look at them in terms of linkages rather than in terms of isolated cases. And when we look at them in terms of an integrated approach, it is also necessary that we recognize that if we are going to use ICTs, then these have to be done in an integrated way between many sectors, many partners, and many stakeholders. But in doing so, we face many great challenges, and there are huge challenges posed for those who are tasked with the mandate or the responsibility of actually deploying these technologies. So it is important that as we begin to explore what we do, that you go back to the practical exercises cited in the module, that you go back to the tests to see if you have understood the concepts, and to recognize that all of these are interlinked, intermeshed, interconnected, not just inside a country, inside communities, in a globalized world, and to look at any one of them in isolation is to do injustice not only to the efforts but also to the global efforts toward development. I bring to conclusion this part of the module where we looked at applications, specific case studies in relation to the MDG goals. This section was necessary because it drew your attention to some very major programs taking place in different parts of the world. And in the next part of this module, we will begin to look at what makes for ICT projects to succeed, what are the causes of their failure, what are the kinds of things that policymakers, that implementers should keep in mind while they are developing their ICT programs. As you look at the modules and as you look at this presentation, please make the link between the two and see that again there is a synergy between the print version and this presentation. This presentation, which is really intended to enhance or help you to see what you might learn in the print version of the modules. I would also recommend that you go to the websites that are cited and you explore on your own and to try to determine in terms of how in your own country you could choose one sector, see how it relates to the others, see how a program can be developed whether this is direct or whether this is indirect, how you would achieve the objectives, and what ICTs would help you to achieve the objectives of the program. So we move on now to the next section of the module.